Let's talk about how not to have atrial fibrillation. Well, what is atrial fibrillation? Well, it's an abnormal heart rhythm in which the top of the heart, the atria, are contracting very rapidly and erratically. And it sends those erratic, rapid signals into the bottom of the heart, the main pumping chambers of the heart, and your heart rate can be 150 beats per minute, 180, 200 beats per minute, very rapid. That's why people become lightheaded or breathless, and if it's sustained, you can go into heart failure. So it's a very tricky rhythm to manage, and it has real implications. If you stay in atrial fibrillation all the time, it has stroke risk, for instance, because those atria that are quivering allow blood clots to form, and they can go to your brain and other parts of the body, which is typically catastrophic. So you don't want to have atrial fibrillation. The older you get, the more likely it is you develop the rhythm, and if you have other forms of heart disease, like a cardiomyopathy, or coronary disease, or valvular heart disease, it raises the likelihood that you'll have atrial fibrillation. So what can you do to minimize the development of atrial fibrillation? Now, my comments apply only to intermittent fibrillation. That is, you have occasional bouts a few minutes long. If you're in atrial fibrillation all the time, well, then you've lost the chance to prevent it or suppress recurrences. So my comments refer only to preventing getting atrial fibrillation, or to reduce the likelihood of intermittent recurrences. Because once you get to full atrial fibrillation, there's no turning back in preventive efforts, right? So the key here is don't let that happen. Also, you can avoid all the management difficulties. So if you had atrial fibrillation that was persistent, you know that they give you drugs to slow the heart rate down, like beta blockers. They give you drugs to thin the blood to prevent the stroke. They give you drugs to convert the rhythm, and it can come back, and it's hospitalization, all kinds of issues to address. And so it's a great advantage to not have atrial fibrillation. So what can you do to either prevent getting it or stack the odds in favor of not having recurrences, or reducing the duration and the frequency of recurrences? Well, the diet we use in my Wheat Belly and Undoctored programs, where we eliminate all wheat, all grains, and minimize our exposure to sugars and carbs. That helps a lot. Now, I don't know why. I've had people who had terrible atrial fibrillation recurrences, and they completely come to a stop. But we don't know how to predict if that applies to you or not, because the mechanism of this is not understood. But nonetheless, because that dietary lifestyle has such extravagant benefits otherwise beyond AFib, it's worth trying. So wheat and grain elimination, and we cap our net carbs at no more than 15 grams net carbs per meal. Magnesium. We drink filtered water, and water filtration removes all magnesium. And if you eat grains now or ate grains in the past, grains have something called phytates that bind most of the magnesium in your intestinal tract, and you poop it out in the toilet, so you don't get magnesium from food. And modern food is depleted in magnesium. Produce, vegetables have much lower magnesium than they used to. End result is magnesium deficiency, profound magnesium deficiency in modern people. And magnesium deficiency makes heart rhythms unstable. Intravenous magnesium is one of the first things we give people in the hospital when they have heart rhythm disorders like atrial fibrillation, ventricular tachycardia, multifocal atrial tachycardia, etc. So magnesium, you don't want to get to the point where you're in the hospital for your heart rhythm, but you can use magnesium chronically, and consider using the magnesium water, the best form of magnesium you can't buy, but you have to make. Those recipes are in my Wheat Belly blog, Undoctored blog, Wheat Belly Total Health book, Wheat Belly 10 Day Grain Detox, and my Undoctored book. Omega-3 fatty acids probably reduce the likelihood of developing atrial fibrillation and or recurrences. The evidence is a little bit spotty, a little bit sketchy, but it looks like it probably has at least a modest effect. Vitamin D, we need more evidence here, but I'm convinced that vitamin D restoration, recall what we do is we use oil-based gel caps of vitamin D3 or cholecalciferol at a dose sufficient to achieve a 25 hydroxy vitamin D blood level of 60 to 70 nanograms per milliliter, typically 5,000 or 6,000 units per day. And that seems to have a suppressive effect on recurrences of atrial fibrillation. Here's a new one for you. The oxytocin boost we get from our Lactobacillus reuteri yogurt. So see all the posts on my Wheat Belly blog, my Undoctored blog, on how to make Lactobacillus reuteri yogurt using the 2 strains we use. Remember, strains are very important. You just can't use any old reuteri. You have to use the 2 strains we know work. And one of the effects of Lactobacillus reuteri consumption, and we use yogurt just to amplify bacterial counts, One of the effects is to cause your hypothalamus in the brain to release more oxytocin. And oxytocin is known to be rhythm stabilizing. It cuts back on the chaotic type of electrical behavior that leads to atrial fibrillation. And then lastly, consider heart rate variability, manipulation and monitoring. We haven't talked much about that. HRV. So the healthiest heart rate is not perfectly regular. The healthiest heart rate is irregular, not to the extent of atrial fibrillation, but irregular in that it's in synchrony with your breathing, okay? It's in synchrony with inspiration and expiration. Now, that's a whole conversation that I'll address another time, but suffice to say that there's a wonderful app. It's either free or a few dollars called Heart Rate Plus Coherence. Heart Rate Plus Coherence. And it shows you how to use heart rate and how to control heart rate. And if you do this with some regularity and you learn how to trigger the response, you can actually turn off, at least in mild cases of atrial fibrillation, you can actually stop or turn off atrial fibrillation if it's mild, okay? Or prevent recurrences. So let's say some people, for instance, know if they're stressed or they're sleep deprived, they're going to have an episode of atrial fibrillation. You could use the relaxed state, the increased parasympathetic tone that you enjoy when you manipulate heart rate variability. Now, we'll address that in more detail in the future. But those are some ideas to try to help you prevent having the aggravations and the health dangers of atrial fibrillation, or to cut back on the likelihood of recurrences.